Hi everyone, Dr. Kolaiko here, and today I want to talk about COVID-19 vaccines in children. So this topic specifically is very near to my heart because I've mentioned before I'm a parent and I have a young child. And so, as parents, we always want to make the best decisions possible for our children, and we never want to do anything that could possibly hurt them. So when it comes to making medical decisions on behalf of our children, it is difficult. We have to weigh the risks versus the benefits based on the information that we have, and all we can do is our best. And the reality when it comes to risks to our children is that from the moment we bring our children into this world, we are exposing them to different risks. When we put our child in the car and we go for a drive, we're exposing them to a risk of a car accident. And when we send them off to school, we are also exposing them to risks of various kinds, including infectious diseases. So when it comes to that decision, do I vaccinate my child or not? The vaccine itself also carries some risk to it. And one of the most publicized risks recently has been the case reports of myocarditis in young adults and children who received the Pfizer or the Moderna vaccines. So myocarditis is inflammation of the heart tissues. And when these case reports started coming in, because some of these cases were serious, some people had to be hospitalized from it, the FDA and the CDC started taking a very close look at these cases. So that shows how when these serious events come up, even when they're very rare, the FDA and the CDC take it very seriously and they investigate. So what they found is that as of mid-June, approximately 300 million doses of the mRNA COVID vaccines had been given, and there were about 1,200 reports of myocarditis following either the Pfizer or the Moderna vaccines. So if you look at those numbers, you can see it is a pretty rare occurrence. It does not happen very often. And the reality is that your risk, if you're a young person in that age group, your risk of having myocarditis if you get actual COVID disease, is 6 times higher compared to your risk of myocarditis following the vaccines. So also the CDC did a risk-benefit analysis. And what they found is that in that young age group, age 12 to 17, for instance, if they give 1 million more second doses of the mRNA vaccines, you might see possibly about 60 to 79 more cases of myocarditis. And at the same time, you could prevent 400 hospitalizations, 100 ICU visits, and 3 deaths. So in this calculation, the benefits of the vaccine clearly outweigh the possible risks of the vaccine. So as parents, we never want to do anything that would intentionally, hurt our children. And, even if that likelihood is very, very small. But if you think about the risk out there, now that we have the more contagious Delta variant circulating, now that we have schools reopening and the more potential for infection, now that we know our hospitals are filling up and overwhelming our healthcare system, the choice is clear for me. If I had a child that was eligible to get a vaccine right now, I would vaccinate them right away. Now, we know that over 8 million children ages 12 to 17 have already safely received the vaccines. So that gives me a lot of peace of mind that there is a lot of clinical experience with this vaccine in this young age group. So my child is actually younger than this. And so I'm going to wait and see when the data come out from the clinical trials in terms of the effectiveness and the safety of the vaccine in that younger age group. And then I'll make that decision of whether I think the benefits of the vaccine outweigh the risks in that younger age group. So Think of it like putting on a seatbelt. I mentioned when we put our kids in the car, we're exposing them to risk, right? But when we buckle them into their car seat or we buckle them into that seatbelt, we know that's not 100% effective at preventing death in case we get into a bad car accident. But we do know that the chances of survival are going to be much, much higher if we use those safety measures compared to if we don't. So for those who are too young to be vaccinated, for now, masks are going to be the most effective tool at preventing the spread. And so having their mask on at all times when in public is a good idea, and encouraging everybody around them to mask up as well is going to be able to protect them. So the good news, for those of us that have younger kids, is that the younger they are, the less likely they are to get infected with COVID-19. And if they do get infected, it's more likely to be a mild form of the illness. But that, the risk is not zero. There's still a chance that they still could get infected. So it's important to take these precautions in the meantime. So I hope that information was helpful to you, and I will see you next time.